Hello, a very warm welcome here from Heidelberg. I am Christian Mertens. I work here in the University Hospital of Heidelberg since almost 17 years now. I am in the maxillofacial department here, and I'm responsible for implant placement and bone augmentation procedures. Just to give you a short impression, I brought some pictures of our department. This is the area where we treat our patients. Those are the typical treatment rooms, and here's a small insight into our operation theater where we perform the surgeries. We got 3 operation rooms in our department and 2 in the central operation ward. And this is the operation area where we perform the surgeries, and here's our recovery area. And the topic today I wanted to bring with you is the treatment concepts for bone augmentation procedures. And I wanted to talk with you from simple to complex and talk about certain principles which apply to all situations. So the basic issue we have is that after teeth are removed, there's some bone remodeling taking place. And this remodeling doesn't only make an extraction socket heal, but we lose bone. Remodeling always results in a loss of bone. And especially most pronounced, the area here on the buccal side is visible from the very beginning, and it continues over and over, and we will lose also vertical components over time. So what are our options? We got basically 2 ways to go. On the one hand side, we got the regenerative approach, and on the other side, we got the avoiding bone grafting procedures approach. Yeah? On the regenerative approach, we see quite some very common bone augmentation procedures as GVR procedures, sinus lift surgery, and on the other side, we see typical aspects as short implants, narrow diameter implants, different options we have, all on 4 concepts that are available. But before we treat our patient, we first have to decide what type of treatment do I do on that specific patient. Do I either go the regenerative approach, or maybe do I avoid bone grafting procedure? And this decision making can sometimes be difficult, and that's something we want to have a closer look at.